I don't know who to give it to.
Give it to her because that kind of didn't pick up real good this morning.
Okay.
If you want to give it to her, I'll take that if you want to.
Do you want the stand?
Yeah.
Okay.
I'll take it. Because I'm going to need it.
I'm Maggie if you guys need anything.
Thanks.
Okay.
Thanks.
Absolutely, yeah.
You hanging out back here?
Yep. Do you need help putting it on, or
You might as well get to the stage.
you got it?
So, okay, we won't be mic'd over here. We'll just be on this.
Yeah, and he's got the wireless one. Perfect.
Yeah. So my thought is it may be.
You good with this? You know how to
I think
put it
so.
on? Okay.
I think.
Well, I'm Maggie, so if you need anything, just let me know. I'll be
Great.
right back.
Sounds wonderful.
The
Thank you.
health center meeting, it ended up being Jeff, Oscar, and Mike. And God is always with him and Andrew. So that was pretty interesting. The elected officials one, it was, yeah, Mike came, Andrew came, and then Carol Wayne.
I'm going to take my bottle of water up there. I hope that's okay.
The elected one.
I've talked a
Very
lot more
well
than
worn.
usual today, so my vocal cords are a little tired.
Diane Badiano, the deputy came. Two commissioners came.
Vouch for your life. Like, I promise, this is what I know.
Mike
This is what I
Marshall,
do.
Corrections
You know, people have
Officer,
had such
council
good
people
questions, and we've had some really good
Commission came.
conversations.
Who was it this afternoon?
One of those PD
Oh,
board
yeah,
members
how was that?
came.
Because I left.
There
How
was
did
like
that go?
legislators and
One health department staff, they did your emergency
corrections, and
test lot codes.
it went very well. Very well. Yeah. it's
We
okay.
have some real good supporters in the legislature.
Yes. One from my hometown even
Are
said
you
nice
mic'd,
things
Lindsay?
about me. I am mic'd. Can you hear
So-
me?
So we can get it ready whenever you're ready.
Yeah. I just
So
needed
we'll do-
water.
Yeah, we do it like this since nobody's here if it's streamed, and we'll just go from there and we'll tee it up.
That works
whenever,
for me.
Whenever you all are ready. Okay. Good evening. On behalf of the Douglas County Board of Health, I want to thank the Omaha Public Schools for their use of their facility today and tomorrow, and their graciousness in letting us use their facility. We want to thank them a lot. Tonight is our community opportunity for people to meet the finalists for the Douglas County Health Director, Dr. Lindsay Huse. How we'll go about this is we will ask Dr. Huse to introduce herself, give us a little bit of background on where she's from, her roles, and there are some questions that have been given to us, so we will give those questions to Dr. Huse. We are scheduled to be here to 7, and so based on the questions that we have where we go, we'll go to that amount of time. Note for the public and those that may be streaming and watching, we ask for questions to be submitted ahead of time so we can pose them to Dr. Huse, and so that's what we'll go about on that route. So with that, I also want to note I have Secretary for the Board of Health, Ms. Jeannie Wise, here with me, and we'll just be teeing this up for Dr. Huse to answer. So, Dr. Huse, good evening. With that, if you want to introduce yourself to the people that may be streaming and give us a little bit of background as you did today. Thank you.
Sure, absolutely. Good evening. My name is Lindsay Huse, and I am just very grateful to be here this evening and to have the opportunity to introduce myself to the community and to take some questions from the community. And probably people have a little bit of some questions about my background and who might be coming into this role. So I'll start out with saying that I am a Nebraskan. I was born and raised in Gearing, Nebraska, which for those of you who may not know is in the Panhandle, right next to Scottsbluff, Nebraska. And I grew up there. I was raised there, graduated from high school there. I attended Western Nebraska Community College for my first 2 years of college, and then I transferred to University of Nebraska Medical Center College of Nursing, the branch there in Scottsbluff. And I obtained my Bachelor's of Science in Nursing degree there. And that was a wonderful experience, and I'm so grateful that we have those types of opportunities available to us in Western Nebraska. From there, I discovered that public health was really where I wanted to be, and I moved to Lincoln, Nebraska, where I worked for 5 years at the Lincoln-Lancaster County Health Department as a public health nurse. And in that capacity, I really had the opportunity to float around, to experience multiple different kinds of public health nursing, and really broaden my scope. After that, I moved to Colorado Springs, Colorado, where I worked as a nurse epidemiologist and in some other nursing roles for Fort Carson, the U.S. Army installation that's attached there to Colorado Springs, excuse me. And in that capacity, I had an even greater role in terms of really experiencing what it means to collaborate in public health. So working for the military, there were a number of community partners that we had to work with in order to make public health work. And that was a wonderful experience. While I was there, I was able to help lead the H1N1 response back in 2009. So I had a lot of experience in a number of different emergency management and emergency preparedness roles as we did that response there at Fort Carson. And then from there, I was able to work for the Wyoming Department of Health, where I am currently, and serving there as the state supervisor for public health nursing. That's been a wonderful opportunity. I oversee the staff for the entire state in terms of public health nurses, and oversee the programs that they are carrying out in their individual communities. So not just, taking care of the nurses, but also all of those different public health programs and how those are implemented and carried out within their communities, how they're assessing communities to see what sorts of needs are out there, and so forth with that. So, the past 16 months, of course, have been incredibly busy in public health as we've had the COVID-19 outbreak. And that, of course, we've had quite a bit of involvement in the response for. And so overseeing really how each community is, through their public health nursing staff, implementing COVID-19 activities, really from the very beginning of the pandemic, when we were just trying to get our heads around what exactly was going on, trying to figure out the best ways to keep people safe, as we were learning more about the spread of the disease, and then through into where we're now vaccinating our communities against COVID-19, and really working closely with the response on that. So I've been in multiple places in public health, which has really given me quite a breadth of experience. I got my master's in public health from the University of North Carolina, Chapel Hill, in 2015. And that was also a fantastic experience. I had a leadership focus and also concentrations in public health practice and in epidemiology. So this past 16 months felt like something that definitely we had trained for. And while many of the challenges that we came face to face with were challenges that maybe we didn't anticipate necessarily, I felt like I was well prepared in order to lead a public health staff as we moved through that response work. I also got my doctorate in nursing practice with a public health nursing specialty from the University of Colorado, Denver Anschutz campus down in Denver, Colorado. And that really prepared me to be able to take a lot of interventions and theoretical work and be able to translate that into practice in an actual community. And that actually happened just prior to the COVID-19 outbreak, so it felt a little bit like I graduated with my doctorate and they threw a pandemic to celebrate. So that's a little bit of a history on my background, but probably what you're even more interested in is hearing about my philosophy in terms of public health. So the role of a health director is really one of guidance and consulting and collaborating with the community. So public health does not work well if we do it in a silo. It does not work well if we feel that we have to solve all the world's problems by ourselves. It really takes an entire community to do that. And so really the job of a health director is to make those relationships with other people in our communities who can help us to advance public health. And public health is for everyone. It touches every life in a community. And so it doesn't matter what you believe. It doesn't matter what your perspective happens to be. If you're part of the community, you need to be served by public health, and we need to listen. So another job of the health director is really to do a good job of listening to all of the different stakeholders that are involved, all of the different agencies and organizations that we're partnering with, and most importantly, to listen to the voice of the citizens that we serve. So that is a little bit about my perspective on public health. I like to lead through connection with people, developing strong, trusting, and transparent relationships with stakeholders, and to lead in a way that's courageous enough to ask and to engage with some of the more difficult questions rather than avoiding them. If we don't have conversations around the hard topics, we're never really going to advance the truly meaningful components of public health that we need to focus on the most. And with that, I will be happy to take questions.
Okay. Well, you mentioned hard topics. Let me just go into one question that came. It says, please, Dr. Huse, what are your thoughts on mandating medical interventions such as masks and vaccines?
Thank you for that question. So that's an important one, and probably one that's on a lot of minds. First of all, it's important to understand that the health director does not have any power to mandate anything. Our role is to provide good, solid science and data in order to make good decisions. Mask mandates, I know, were controversial, but they worked. It was not always the most comfortable thing for people to have to engage wearing a mask when they went out. However, we saw COVID-19 rates drop significantly when mask mandates went into effect, not just in Nebraska, in a community in Nebraska, but really across the nation. And so it's really difficult to have conversations about mandating anyone to do anything. And while those types of mandates may come up, they're typically not being mandated directly by the health director because he or she just doesn't have that power. However, there are times when we have to look at how our actions are impacting our neighbors, and sometimes making decisions that make a small sacrifice for our neighbors can be a really important way to impact the health of the entire community, not just ourselves.
Sure. Max, one question states the Omar area does not have any clinics or special times, places set up for people with disabilities. What would you do to put in place to help this population with vaccines and shots?
Great, thank you for that question. So in terms of disabilities, that can mean a variety of things. And so not having been here working in the vaccination clinics in Wyoming, I would of course need to be familiar with what is available and assessing, are there components or are there people in the communities who are unable to access vaccine for some reason, and really working with the community to identify ways that we can minimize those barriers to access. That could mean, is there a building that is more accessible for somebody to access? Does it make sense to engage certain people within the healthcare community to get vaccines to certain proportions of the population? And that really would be dependent on what the needs are. For disabilities, that can range from, there's just a huge range that could be included in that. So I definitely would want to know specifically what the needs are, and then to partner with people in our community who have solutions for those barriers and really getting people into access that way.
Okay. Next question asks, WIC is one of the larger grants for the Douglas County Health Department. Do you have knowledge of the program, working with the program in the past?
Yes, thank you. I am quite familiar with WIC. I have not directly carried out a WIC program, but we in Wyoming partner extremely closely with WIC. It's actually a sister unit within our division, and I work very closely with our WIC personnel, and in fact, a lot of our public health nursing offices, their office with WIC. And so it's important for us to ensure that we have ways to refer people into WIC services. WIC has been an excellent partner for us in terms of referring people into other public health services. So it's an extremely important partnership. Prior to that, when I worked at Lincoln-Lancaster County Health Department, our WIC clinic actually was embedded within our clinical services, and so it was literally down the hall. And that was a wonderful experience, again, because we were able to really ensure close collaborations and sharing referrals and ensuring that people were able to get into services as needed, and ensuring people knew about WIC. Sometimes they don't realize that they qualify for WIC and other services. So really, helping to do outreach and helping to get as many people into that program as possible. I really believe in WIC. I've seen some just amazing things happen, with the services that they're able to provide. It's exciting to me that we have WIC in our department here in Omaha, so really excited to be able to work with them as well. And I do know that that is a very large grant and has some pretty specific guidelines around it, and familiarizing with that should be something that's very doable.
Okay, next question is, it's long, so I'm going to paraphrase part of the question. It says, Dr. Huse, your hometown, you're a native of Gary, Nebraska. I grew up in that area, and it has a history of discrimination toward Latinos, immigrants, and Native Americans. I would like to know what's your history of working with people of color, and people of color, particularly Latino population, and how would you work to outreach to those communities as health director?
Great, thank you for that question. And you're right, the area that the question spoke to does have a history of racism and discrimination against not just Latino, but other persons of color as well. And to that I say, I actually have a number of close friends that are Latino. And one of the things that is very important to me is ensuring that as we're addressing racism, that we look inward and know what our own biases are. And I really have asked friends to reflect to me what kind of learning I might need to do to be a better ally and a better partner for the Latino population, also for the Black community, also for Native American communities. Working in Wyoming, we actually have a high population of Native Americans. We have a reservation there that spans a couple of different counties that we serve, and we have worked very, very carefully and very hard to try and develop and maintain relationships in a very respectful way, in trying to ensure that they know that we are there to help in any way possible, but of course not overstepping any boundaries that might exist there. I can say that moving forward in terms of a health director position addressing racism, I absolutely believe that that is a priority that should happen. Racism is one of the biggest underliers that impact the social determinants of health. And I don't see how we get to being a healthier and a more vibrant and resilient community if we aren't addressing racism as something that is existing in our institutions, in the way our structures are built, and really within ourselves. It's very important that we do that kind of self-reflection. And so working with these populations, I recognize fully that I don't know everything. I have not experienced racism. Other people have experienced that, and I need to learn. I need to understand what those experiences are like, and I need to walk with them, not ahead of them. I really need to walk beside them and help to remove barriers. So those are really some of my priorities in terms of addressing racism in this particular position.
You alluded to it a little bit in this answer, but the next question kind of goes in there, so I'm going to explain why Douglas County recently declared racism a public health crisis, and other counties around the country. Mm-hmm. Explain to me why racism should be declared as a public health crisis.
Great. I want to frame this in a way that really captures the passion that I feel around this particular issue. So racism and the trauma that incurs on a population is something that is a total barrier to that population being able to be as healthy and as vibrant as possible. And when it comes to public health, we're really only as strong as our unhealthiest people in our communities. Addressing racism means addressing barriers to economic growth, barriers to jobs, barriers to safe and affordable housing. All of these things are things that have to be in place in order for a community to really, really become as healthy as possible. And so racism as an underlying factor in a lot of those social determinants of health absolutely is something that just has to be addressed. And besides the fact that it is a major player in how those social determinants and that environment is experienced by a large proportion of a population, it's just the right thing to do. These are people that we're talking about. These are humans that we're talking about. And they have the right to experience the fullness of health as much as anyone else in a community.
Thank you. In our community health needs assessment, mental health was identified as a major issue here in the community. What would be your thoughts on the public health department and its involvement in addressing the mental health issues here in Douglas County?
I think that addressing mental health issues in Douglas County is something that absolutely should have a priority, especially based on the fact that the community health assessment that occurred shortly before the COVID pandemic really focused on mental health as a priority that not just Douglas County, but Sarpy-Cass County and Potts County across the river really wanted to ensure had a strong focus. In fact, they picked that as their sole focus as a priority after that community health assessment. And then COVID happened. And the truth is that COVID has been extremely, extremely traumatic for most people in some way. If you didn't lose a loved one in the pandemic, you might have had COVID-19 and experienced a loss of health. You could have lost a job. You could have lost your business. There were a lot of very, very traumatic and hard things that came out of the COVID-19 pandemic that we're still experiencing. So I would expect that mental health issue and priority that existed before the pandemic occurred probably is even more of an issue now than it even was then. And that's true of a number of health disparities. They've probably widened quite a bit due to the pandemic. So having that as a goal, as a priority to work on, really is going to be instrumental in helping the entire community bounce back in a very healthy and resilient way. Mental health underlies almost every part of our life. It impacts how we go about our days. It impacts our productivity on our jobs. It impacts our physical health. Stress is one of the leading causes of issues such as high blood pressure, obesity, diabetes, all of these chronic issues that in public health we typically want to have a focus on preventing, have a huge stress component involved. And so it makes a lot of sense to ensure that we're focusing on mental health services within the community. And that can be anywhere from trying to foster and improve actual behavioral health and mental health services that people are able to access, or coming up with creative and new ways to address mental health in a community that may not be in a clinical setting necessarily, but may be fostering connection and community growth in other ways.
Okay. What do you see as the greatest threat outside of COVID to public health in an urban community like Omaha?
It's a really, really good question. You know, I think that really figuring out where we are and not doing a good job of figuring out where we are after this pandemic could be extremely detrimental, especially in an urban area that has a lot of diversity, a lot of different health components that are existing in a community. Ensuring that we are able to quickly assess what the needs of our community will be going forward will be very necessary. Without that, we aren't going to hit the mark. Without having a good assessment of what's happening in our community, what the disparities look like in our community, what new health issues may have even come up in a community, we can't possibly do a good job of addressing those. So I think that's going to be something that's very important in the months to come. And I will also say that ensuring that we really strengthen that foundation that we have in public health, so those social determinants of health that we know are huge influences on people's ability to be healthy. So things like education, housing, jobs, all of those that kind of underlie the structure of public health, ensuring that that foundation is extremely strong going forward is going to make our entire community a lot more resilient to whatever threat might come along. You know, pandemics, this is the first big pandemic maybe we've seen in our time, but it's not the first pandemic that's ever occurred. Certainly there have been many, and there are a lot of other threats that are out there, and at some point something else is going to happen that's going to create a public health emergency, and having that really strong foundation to respond from and having a community that's already really resilient is going to go a long way toward mitigating whatever that threat happens to be.
Thank you. My question is focusing on the youngest populations within our community. It's a population that's near and dear to my heart. So the social determinants of health over the last 16 months has also had a significant impact on this particular population and their overall health and well-being. If you had to pick one social determinant of health that you could fully tackle as you enter your role as a health director, if you could only pick one, but put all your heart and soul into that one, what social determinant of health would you stick your flag in and say we're going to move the needle on this particular issue for children?
That's a tough one because I want to pick all of them. And you know, a lot of the social determinants of health really have a lot of interplay with each other. So hopefully by focusing on only one, you're going to be, just by nature of that interconnectedness, impacting the others. So I really can't emphasize enough how important education is. I think that giving children an early start and the ability to succeed in life, whatever that happens to look like. You know, not everybody has to go to college, but giving kids that foundation to really set the course of their life and to live in a meaningful way and be able to support themselves and to develop a sense of self-efficacy and achievement. I think it starts having a very strong education system and being able to keep kiddos in school. I also know that the education system provides a number of other services for kids that are vital. I know that a lot of kids have suffered over the past 16 months, especially in places where schools were fully virtual or even partially virtual because kids weren't receiving the same level of services that maybe they were able to receive traditionally. And so that was something that I was proud to be able to work on in Wyoming, was serving on the Smart Start plan, which was the governor's task force to really develop a well-informed way to get kids into school for the coming school year and also keep our teachers safe, because obviously education isn't going to happen if we don't have healthy teachers. And I was very proud of the fact that we were able to keep kids in school. Did not have too many issues in terms of COVID outbreaks with that, but just ensuring that they have that base. And really, if you're impacting education, as they grow, as they get older, you're also giving them better opportunities for jobs, for purchasing housing if that's something that they want to do, and being able to kind of just self-direct their lives. And so that's just a very important component.
Okay, from the solicited questions, this is the last one. So, Dr. Huse, you will, if everything goes your name, the director, you'll be walking into continuing to manage an emergency situation as the pandemic is winding down, but it still hasn't ended. So what's your experience in running emergency situations or being in an emergency environment?
Great. So emergency management, emergency preparedness, that whole world has been part of my career for most of my career. So even starting back in Lincoln-Lancaster County Health Department, when I worked in the communicable disease section, that was actually embedded with emergency preparedness, public health emergency preparedness. So we worked side by side to develop tabletop exercises, real life exercises. So actually walking through the motions of responding to a public health emergency, having input into the plans. Pandemic planning became really, really important after 2001, when we had obviously 9/11, and then we had the anthrax letters that occurred, and it became apparent that we maybe weren't well situated to respond to those sorts of things. And so it really kind of came in as a very important part of public health. After I worked at Lincoln-Lancaster County, I went to work for the military, which kind of already has an embedded incident command structure or emergency preparedness structure. It's just part of the structure of the military. But serving as their nurse epidemiologist, I had many roles in emergency preparedness and response. So during the H1N1 outbreak that occurred back in 2009, I was able to serve as a liaison to many of the other people in the community. I was also a PIO type role, along with a military component, but really working on the messaging and the coordination of risk communications during the H1N1 pandemic. And then, of course, coming to Wyoming, I actually oversee the nurses who manage the public health readiness coordinators. And so this is something that we talk about every single month. There are all sorts of plans and tasks that come along with that. And so really managing and making sure all of that work is happening. And then COVID-19 happened. And in that, I've really had the opportunity to watch and oversee a number of incident command structures across the state and really be able to advise on how those structures are functioning, how those roles are being carried out in different communities, which can look very different depending on the community you're in and the needs that are there. And so really serving again in a communications role, in a liaison role, working with county commissioners and county health officers and just a number of different people in that response. I'm also trained across the spectrum of the incident command certifications and trainings that are required typically in a public health leadership role. So it's been part of my vernacular for 20 years, and it's a, you know, it's a place that I'm comfortable functioning in. So.
Well, to those that may be watching streaming wise, as you said, these are the questions that we had that were solicited. Our goal was to answer some of these questions for about a half hour, and then hopefully if people were here and they came during a period of time, they'd have a chance to meet the candidate. So in regards to the questions, they will formally stop now, but for anybody that may be streaming, we'll be here for probably another 30 minutes or so to give the community an opportunity to meet the candidate. And with that, those of you who tuned in, thank you. And with that, thank you, Dr. Huse. We'll go from there.
Thank you. I appreciate the time.
I guess we'll close. Is there anything closing you'd like to say before we sign off streaming?
I would just like to say thank you for the opportunity to serve this population, this community. I'm really excited at the prospect of being home in Nebraska and serving Nebraskans, and just really to be able to do what I love in a place that I love. So thank you very much for the opportunity, and I really do look forward to serving the community in the future.
Thank you. Alrighty. Appreciate it. We're like I said, officially we'll be here, and thank you all for viewing and for your interest in the direction of the health department. That guy's in the public.
Like, is it still going, or is it? Okay. Sounds good.
I think, depending on that, I'm going to keep it probably for 30 or 45 minutes question-wise. And I didn't know who may show up, but if nobody's here, that's what it is.
Okay. I didn't know if it was just reporters or if anybody here was.
Yeah, we're going to hang out a little bit.
Okay.
Have fun about it.
But you don't want this to continue to be recorded, right? Okay. Sounds good. Absolutely, yeah. My pleasure. Whoa, nice finish. Stand out.
Zoom is allowed me to hear.
Yeah, no kidding.